And looks like we have everyone from Regence. Is that correct?
Believe so.
Fantastic. Well, please begin by introducing yourselves and explaining your rate requests.
All right. Good morning, and thank you for inviting us to speak today. I'm Dan Bader, and I'm joined by Logan Mealy. We are both actuaries with Regence BlueCross BlueShield of Oregon and appreciate the opportunity to share details about our 2022 individual and small group ACA compliant rate filings. Regence has a long history serving Oregon. Over the past 80 years, we've served our community through nonprofit health insurance coverage and member-focused services. We service nearly 1 million Oregonians and have offices across the state. Oregon is our home, and we remain committed to serving the community for the long term. I'll cover the individual and small group rate changes at a high level, and then Logan will speak to some of the more nuanced details on the coming slides. For individual, our average annual rate change is 4.7%, and small group is 6.6% for Q1 renewals. Note that these rate changes are primarily driven by the increasing cost of medical care.
All right, can you guys hear me okay?
Yep.
All right, well, so for our individual plans, the average annual rate change, as Dan said, is 4.7% for 2024, with the main driver being the cost of medical care. We do not have any new individual plans for 2024, but we do have a few discontinuations. First, we are eliminating the Gold 2000 plan with dental and vision embedded for both our individual and family network, as well as our legacy network. In addition to those two, we are also discontinuing our Bronze Essential 8000 plan from just the legacy network. Lastly, there are some cost changes to our plans in 2024, but there are no changes to our existing provider networks or removal of any benefits for 2024. All right, and I will jump to small group. So for our small group plans, the average annual rate change for 2024 is 6.6%, again, with the main driver being the cost of medical care. However, on the small group side, we are experiencing rapidly increasing utilization and GLP-1 drugs, which is causing some upward pressure on our rates in 2024. For 2024, there are no discontinued plans, but there is one addition in the new Bolster Care Bronze 9000 plan. Similar to the individual plans, there are some cost share changes for 2024, but our service area remains unchanged, and currently there are no proposed changes to the provider networks or any removal of covered benefits. And I don't believe we have a TikTok yet still, but if you would like to connect with us here at Regence, please feel free to use one of the listed social media platforms there. And that's all we have. Thank you for your time. You can take any questions if there's any.
Thank you. Division staff will now lead a discussion about the division's review of the filings and preliminary decisions.
Hi there, my name is Tim Hinkle. I'm the primary reviewer on these two filings. I'll let some other folks introduce themselves.
Hi, everyone. My name is Tasha Sizemore. I'm the Life and Health Program Manager for the Division of Financial Regulation.
Hi, I'm Kirsten Anderson. I'm a Deputy Administrator here at the Division. And TK, our administrator, is in the meeting. He's been having some Teams issues, so I don't think he can come on camera to introduce himself, but he is attending.
All right, thank you. So I'll give a little bit of background here on what we do when we look at some of these filings. So first, we look at the data that the carriers give us from the 2022 experience, and we look at the methodology, which converts that 2022 experience into a projection of 2024 experience, and then we look through the calculations to make sure that we agree with how they got from point A to point B. And so in this case, a lot of the focus really is on those assumptions. And I'll just list off a few. We spoke a little bit more about these earlier this morning, but I'll speak about. I'll just kind of list them off here. So some of the things that we're really focused on were the labor disputes, trend, Senate Bill 1529. Senate Bill 1529 is where it's the 3 $5 copay primary care visits. And there's COVID, there's the Medicaid redetermination, and the basic health plan. And then there's the diabetic drugs, the GLP-1 utilization. So I'll start with the individual really quickly here. So on the individual side, the request is 4.7%. Trend was 8.4%, so the request is less than trend. And the range of the rate request is negative 0.9% up to a positive 6.9%. And you know, a lot of these assumptions that I discussed here, you know, we reviewed these not just for Regence but for all carriers and kind of compared them together. You know, the one that, you know, kind of got a little bit of traction a little bit later on is the GLP-1 drugs. And when we asked the carrier about this increased utilization, they said that on the individual side that there's, you know, very little impact there because of, you know, some demographic and plan differences, you know, between the individual and small group. And so they didn't propose any change on the individual side. So for the individual filing, we are proposing to approve the rate request as filed. I guess I'll just jump into the small group here. The small group, some of the things are similar, but there's some things that I want to point out here. So first of all, the original request was at 6.1%, and that range was 3.5% to 9.8%. The trend is 8%, so the rate request is less than trend. But it's important to note here that quite a bit later on in the review season, you know, we got word of this increased utilization that was emerging on these GLP-1 drugs. And when asked about it, Regence said, you know, on their small group side that this would have an impact. And so the impact was about 0.6 or 0.7%, so not a full percent. And so then when they add that on to what was initially requested of 6.1, that becomes a 6.6%. So on this rate filing, we're not proposing to approve as filed. It's a little bit of a technicality here, but we're proposing to approve as modified because the initial rate request was modified for that additional component. So with that, I think if there's no other questions, I'll just turn it back over to Ethan.
Thank you. Regence, do you have any additional information or comments you'd like to make at this time?
Not at this time, thank you.
The division will consider all information in making final decisions on these filings. We'll now take any public testimony. Please unmute and introduce yourself. All right. Doesn't sound like anyone signed up to testify, so let me remind everyone listening that today, August 4th, is the last day for public comments. They can be submitted through our website, www.oregonhealthrights.org. Thank you, and that concludes this morning's hearings.